I want to share with you a plan for relief, reopening, and recovery. The challenges before us look insurmountable. While we have worked very hard to provide relief, we still have a lot of work to do. We've had more people file for unemployment in a shorter time frame than ever before in our history. I am working to bring our customer service up to meet this challenge. We're bringing on more staff to answer calls. We're using new technology to get through phone calls. And soon business owners and freelancers who have never been eligible before will be able to apply for unemployment. We stopped tax enforcement actions, liens, and penalties. We've changed the tax deadline. We're working with banks, the courts, and the Attorney General's office to protect people from foreclosures, evictions, late fees, and more. We've worked to provide millions of additional meals. We cut red tape so people can get food benefits faster. And we're investing millions of dollars to make sure people are able to access nutritious food for free. Student loans through federally backed programs, or the FIA program, have deferred payments. It's just a start, and we're going to work every day to make sure every Pennsylvanian gets what they need during this difficult time. Never have we had a forced stop of our economy and our workforce. Pennsylvania's businesses are in an unprecedented position. Many shuttered across the state to protect against the spread of the deadly coronavirus. Others changing their entire business plans around to help meet the many needs of people across the state and protect their employees and their customers. We created a state business loan program, and we're working with the federal government to make sure their small business loan programs works. But we need to do more. Our hospitals have borne the brunt of this pandemic, and we need to do more to assist and improve that healthcare system. We made every possible effort to slow the spread of the novel coronavirus and ensure our healthcare system can withstand the ramp up, the surge, and the aftermath of this deadly pandemic. We've provided $450 million by creating the Pennsylvania Hospital Emergency Loan, or the HELP program. And we worked with the legislature to transfer $50 million to purchase medical equipment and supplies for hospitals, nursing homes, and emergency workers to help fight the COVID-19 pandemic. Throughout this crisis, our healthcare workers have been heroes. From the nurses, to the janitors, to the doctors, to the thousands of support staff, they have kept our hospital systems running as admissions have surged. Our researchers and our universities are seeking a vaccine and changing their materials programs to make masks, gloves, or gowns. We've seen the best of Pennsylvania in our healthcare workers, and we need to repay them by staying home, by staying safe, and by supporting their efforts. We've done our best to provide relief, and we need to start talking about reopening. Last night, President Trump laid out guidelines for reopening America. And for weeks, my administration has been at work on a plan to reopen Pennsylvania. And we're going to make sure we have a plan that respects the reality of the situation on the ground and that works with our local, regional, and federal partners. All of us are anxious to reopen the Commonwealth. As a former business owner, I deeply share the concerns of some in the legislature, but we cannot exacerbate the pandemic's damage on Pennsylvanians and their lives. We need to be careful and deliberate. We need the flexibility to react to new outbreaks. Unfortunately, we cannot flip a switch and reopen the Commonwealth. There isn't going to be one big day. We need to make smart, data-driven decisions. And we can't be impulsive. We can't be emotional. We need to follow the science. So when we reopen, we're going to do it with the following standards. First, our approach will be data-driven. We will rely upon quantifiable criteria to drive a targeted, evidence-based regional approach to reopenings in Pennsylvania. Second, we will put forth guidance and recommendations for employers, individuals, and healthcare facilities for assured accountability as we reopen. Third, reopening necessitates that adequate personal protective equipment and testing are available. Fourth, Reopening requires a monitoring and surveillance program that allows the Commonwealth to deploy swift actions for containment or mitigation if it's necessary. Fifth, protections for vulnerable populations must remain steadfast throughout the reopening process, such as limitations on visitors to congregate care facilities and prisons. And sixth, limitations on large gatherings unrelated to occupations should remain in place for the duration of the reopening process. These are actions we are undertaking and the standards we're going to use to make our decisions. Next week, I will be outlining more specific steps on the reopening process as we work with experts in public health, agencies, and stakeholders to determine how to safely reopen our economy. There's not one policy or one answer or one ideology that can solve all of our problems ahead on the road to recovery. But I am offering the framework of a plan to increase wages for all Pennsylvanians, to enact better worker protections, expand paid sick leave and family leave policies, and increase safe, affordable, and high-quality child care. We need to strengthen the unemployment and workers' compensation insurance systems. Let's expand student loan deferments to provide relief for individuals who are on the front lines. And we must expand rapid reemployment programs to support businesses and workers affected by mass layoffs. This pandemic caused significant hardship for many Pennsylvanians, but it also revealed underlying hardship for many. The countless workers who deliver food, who stock shelves, who work a register have always been essential to our economy, but never has that been more clear than now how essential they are to our way of life. They've put their health on the line to make sure we have essential supplies. And while they certainly deserve our gratitude, they also deserve a living wage. As Pennsylvania's economy recovers from this virus, thousands of Pennsylvanians will face a road to recovery of their own. As of today, there have been nearly 30,000 cases of COVID-19 in our state. The vast majority of those patients are going to recover, but this virus is new. We don't yet know much about what, if any, long-term effects it will have. We should change the law to give Pennsylvanians the peace of mind knowing that no matter what happens at the federal level, they will not be denied health insurance coverage due to a pre-existing condition like COVID-19. Or subjected to arbitrary lifetime or annual caps on care. Some industries have been hit particularly hard, such as hospitality, childcare, and manufacturing. We need targeted programs for each of these to help them get back on their feet. And we need to think beyond this crisis so that we build an economy that's stronger and more resilient. For our hospitality industry, we must pass rigorous financial support for small businesses, both short-term to limit the number of businesses closing their doors for good while we shelter in place, and long-term as small businesses restructure and recover. Child care providers, many of whom already earn disproportionately low incomes, have been forced to close all across the state. Some advocates believe that more than 1/3 of child care providers will be forced to permanently shut their doors due to lack of revenue. And yet, we know that as the economy begins to come alive again in the future, we're going to need child care providers to help us care for our children so that we can return to work. We must ensure their wages are fair and the protections are in place for providers in the future. And let's not forget about the importance of our agriculture industry, our farmers. They suffered a severe disruption in our supply chain. Recovery must ensure that certainty and the future of Pennsylvania's agriculture industry to continue to produce a safe, secure food supply. And lastly, it's past time to invest, upgrade, and extend Pennsylvania's broadband network to ensure all Pennsylvanians have access to the internet. It's smart for businesses, it's smart for schools and for people. There are going to be many more ideas on how to recover and how to reopen. These are mine. But I don't have a monopoly on good ideas, and I'm going to need everyone to contribute to our recovery. Each of us, we are each in control of our destiny. Pennsylvania can alleviate this crisis if we choose to do so. The standards and actions I've outlined can help people safeguard our health care system, and it can help jumpstart our economy when the time is right. But moving to reopen large swaths of our economy now, or reducing our flexibility to respond, it's only going to prolong this crisis. So let's focus on things that are productive to save lives and get our economy back on track when the time is right, in a measured way. For years now, the legislature and the administration have worked together. And just recently, we moved our primary election system to keep voters safer. We also created a loan program for small businesses and a fund to prepare our hospitals for the surge. So I'm asking the legislature to work with me to build on this success. Because right now, I need your help. And right now, we're not Republicans and we're not Democrats. All of us, we're Pennsylvanians. And Pennsylvanians deserve and should expect nothing less throughout the life of this crisis. We Pennsylvanians are innovative. We're strong. We're survivors. We Pennsylvanians have set the course of the nation. We stopped previous pandemics in their tracks. We've built machines that have won wars and changed economies. I think back to our predecessors who were met with similar crises, and I can only imagine that they looked to our Commonwealth with hope and pride and optimism. In my 5 years as governor, I have never been more proud of our Commonwealth, and I have never been more lifted by the spirit of our people. Nurses, doctors, grocery store workers, transit workers, police, EMS volunteers, those who have fought through the fear and fog of uncertainty. Manufacturers who have changed their businesses to help provide those on the front lines with what they need. I look back in our history and I see setbacks. I see pain. I see challenges that looked impossible. I see pandemics and wars and recessions. But each time, Pennsylvania has risen. Each time, Pennsylvania has not only pulled itself up, but it has led the nation. We cured polio. We armed our nation for world wars. We mined. We built. We sacrificed. Let's be that example again. Let's stay home, stay safe, and then let's lead. Let's build. Let's change the world around us. Thank you, and God bless the Commonwealth of Pennsylvania.